What is the biggest problem that you see, Dr. Bob, in medical care in the United States? Well, instead of medical care, let's look at the biggest medical problem. There is a metabolic syndrome, or syndrome X. And what it is, it's people that are overweight that have insulin resistance. Now, let's go through that. Type 2 diabetes, people are overweight, and the insulin doesn't work as good as it's supposed to. If the insulin doesn't work as good, then we get an elevated blood sugar. These people, for some reason, end up getting blood vessel disease and end up getting small vessel disease, blindness, amputation, disease in the lower extremities. But they also seem to have elevated cholesterol and blood fats, triglycerides. So now we've got obesity, insulin resistance, elevated triglycerides, and the good cholesterol, the happy cholesterol, the HDL, we want it high, it's too low, less than 40. And CRP, C-reactive protein, that's an indicator of inflammation that's going on in the blood vessels, and then high blood pressure. So if you've got any three of those, obesity, too much overweight, if you've got insulin resistance, type 2 diabetes, if your blood sugar is elevated, if you have high blood pressure, if your triglyceride is too high, or your HDL, the good cholesterol, is not as good as it should be. If you have any three of those, you've got metabolic syndrome. And if so, you've got a great chance of having hardening of the arteries, stroke, those blood vessels, the blood pressure gets so high with hardening of the arteries that they may burst or even close off, and you don't get blood supply to the brain. Increased incidence of heart attacks and problems with hardening of the arteries, high blood pressure, etc. So, if you fit into that pattern of overweight, blood sugar too high, high blood pressure, type 2 diabetes, what can you do about it? Exercise, change your lifestyle, eating patterns. Lose weight, exercise, all those things can go away.